Thank you, everybody, and welcome to our session on Better Together, how Rutgers is leading the fight against a global pandemic. First, let me introduce the speakers. Again, Better Together, the first speaker is myself, just introducing myself, Brian Strom, as Chancellor of Rutgers Biomedical and Health Sciences, and Executive Vice President for Health Affairs, and I'll be functioning as MC in this next hour. Next slide. Then the first real speaker will be Mary O'Dowd. Mary O'Dowd is Executive Director of Health Systems and Population Health Integration at Rutgers Biomedical and Health Sciences, and was previously the Commissioner of Health for the state of New Jersey. Next slide. Mary will be talking about the overview of the state of the pandemic. Then Vicente Gracias. Vince is Professor of Surgery, Robert Wood Johnson Medical School, Senior Vice Chancellor for Clinical Affairs at RBHS, and Vice President for Health Affairs for the university. Vince will be talking about both the clinical presentation and what we've been doing as a university for clinical, and separately also talk about testing. Next slide. Then will come Perry Halkitis. Perry is Dean and Professor of the School of Public Health and Director of the Center for Health, Identity, Behavior, and Prevention Studies, and he'll be talking about contact tracing. Next slide, please. Then is Shobha Swaminathan. Shobha is Associate Professor of Medicine at Rutgers, New Jersey Medical School, and he'll be talking about vaccination. Next slide, please. And then David Alon. David is Professor in Chief, Division of Infectious Diseases, New Jersey Medical School, Director of the Center for Emerging Pathogens, Director of the Public Health Research Institute, and Director of our new Center for COVID-19 Response and Pandemic Preparedness. We are extremely proud of everything that Rutgers has been doing in contributing toward this pandemic. We hope to make that clear to you with all of our contributions, and give you an overview of different aspects. The way this is going to be working is each of the panelists in turn will be talking for about 5 minutes, and then we'll open it up to questions. The questions, we got many questions in advance. We'll only be able to go through a subset of them, but if you have questions during the course of the presentations as well, there's no chat feature on your box, but there is a Q&A feature. So feel free to put any questions you have into the Q&A feature. If we have time, we'll cover them during it. Next slide, please. I'd like to begin with just a moment to honor the memory of Andy Brooks. Andy, who was a member of Rutgers New Brunswick in the Department of Genetics, as well as a member of EOC and director of RUCDR. Andy led the development of the first saliva-based COVID-19 test, passed away suddenly 2 weeks ago, in an incredible loss to his family, of course, to the university and to the world. Over 4 million of those saliva tests have since been performed since March. With that, I'd like to turn it over to Mary. And Mary, you want to talk about the pandemic in general?
Sure. Thank you, Brian, and good evening, and thank you for joining us here tonight. First, I wanted to share as a Douglas College grad that I come from a long line of Rutgers alumni, easily over 100 relatives who are graduates or current students at Rutgers today. My parents, Tony Marquetta and Maureen McDonald, were met at Rutgers, got married at Kirkpatrick Chapel, and are right now upstairs watching my 3 children. I share this not only to display my RU credibility, but also to demonstrate that my dedication to the success of Rutgers is deeply personal. And that is why I'm here with you tonight. My job is to give a little bit of a context for where we are relative to the pandemic and COVID as a public health crisis. Just to look at the statistics, globally, we have had nearly 103 million cases and 2.2 million deaths. Nationally, over 26 million cases and 440,000 deaths. And here in New Jersey, we've had nearly 650,000 cases and 20,000 deaths. The good news is that we've also had over 825,000 vaccines administered. The response to this event for Rutgers really started last January. Rutgers has a global presence, and our first few meetings were focused on how we could help support our students and the Rutgers family in China, Japan, and Europe as cases began to emerge. It was the Rutgers Health leadership, and Brian in particular, that people first looked to for guidance. And as the situation progressed and Rutgers launched its full emergency response, you could see Rutgers Health faculty and staff, Vicente in particular, taking key roles in our response activities, shaping both policy and action for our university. The major areas for our response activities have been around understanding the science of the virus, how it spreads, how to prevent it, testing, vaccination, the impact on our healthcare system and communities, other impacts such as the mental and emotional health of our communities, education, the dynamics of our environment, the issues of society and culture affecting disparities in access to care, and the relationship to the healthcare system for different communities. Rutgers is taking action and making contributions in all of these areas and more. As the state university, we have also worked very closely with the New Jersey Health Department to support their response activities. I have been a member of the Commissioner's Professional Advisory Committee since last March, along with several other Rutgers physicians, bioethicists, and public health leaders. In that role, I have been able to share the cutting edge research coming out of Rutgers prior to its publication with state leaders to help inform their decision making. I've also been able to share back with Rutgers some of the pressing issues facing the state, which has helped to develop some of their research initiatives and our response activities. We have been collaborators as key communication leaders in translating the constantly evolving science with the Rutgers community and the broader public. This week marks the 1-year anniversary that the COVID-19 hotline was launched by New Jersey Medical School for the state. Using the Poison Control Center infrastructure, this 24/7 resource for COVID-19 was supported by a multidisciplinary team, including medical, public health, nursing, pharmacy, and other student and faculty volunteers. Rutgers hosts several crisis counseling hotlines for the state. Brian hosts webinars and town halls. I've launched a new podcast series, and all of Rutgers has been engaged in traditional media. Rutgers truly is a trusted source for information on this pandemic. Many of the rest of the team here today are going to talk about specific ways that we have contributed, but my final message is that in many ways, we are only just in the beginning. As we do see light at the end of the tunnel because of the promise of this vaccination campaign, I anticipate many years ahead of recovery. Many years of recovery lie ahead. During my time at the health department, I led our response to several emergency events, including Ebola and Superstorm Sandy. And what I learned is that the recovery takes much longer than the event of the disaster itself. And we will need to find new and innovative ways to support our communities because of the complexity of this situation. We will need to address the emotional and mental health, recovering from missed physical healthcare services, everything from immunizations to cancer screenings, missed education, the economic impact on families from lost jobs, and it will require a broad public health framework from recovery to building resiliency. Rutgers is going to play a very key role in this important effort. And with this, I want to turn it over to Vicente Gracias.
Thank you. An enormous amount of organizational, administrative work had to be done in order to tap the subject matter expertise across the university. We had to link student health, employee health. We actually had to flex from testing when that was part of the overall process and still remains a huge piece of what we were doing to contact tracing and now vaccination. Behavioral health and wellness needed to be mobilized through the clinical lens of how we were going to support everyone that was in fact working through the healthcare enterprise in order to support the pandemic relief. Clinical operations, ambulatory logistics, a PPE committee, a testing protocol and action group were developed in order to look at the ecology that Rutgers was in and maintain focus on risk across the entire environment, including students and learners. Next slide, please. What TPAG tried to do was that, and continues to do, is advise on testing and identify groups of higher risk. This approach was based on the risk of transmission, and only testing was approved for those groups that were deemed to be at higher risk. This was looked at and informed through CDC and New Jersey Department of Health guidance. But there was a risk assessment and an ongoing active conversation that occurred twice a week and now occurs weekly with the chancellor and other subject matter experts that evaluates the overall testing program across the university. Next slide, please. And begins to formulate a proactive response to the overall pandemic. A lot of what Rutgers Health has done in concert with many of the communication people, engineers, and others is to begin to capture the data through testing dashboards, to show that data publicly, to present it so that people have confidence in what we're doing, to begin to communicate that. Those dashboards, next slide please, were then translated into actionable information. So we can actually now look through the work that Rutgers Health, Health Affairs, Clinical Affairs, as we put all of that data together through the registries, we're actually able to see when athletes returned to work and we had spikes. We then activated contact tracing that you'll hear about. Mitigation was enforced, education was enforced. Sometimes we directed it off campus, sometimes on campus, depending on what piece of the overall environment across our university was projected or deemed to be most affected as they clustered based on the testing activity and the proportional positivity. So we can now see, at least retroactively, but now as we begin to predict what's going to happen in our environment moving forward, we can see holidays, Halloween, Thanksgiving, and other approaches that we then were able to shift and predict that we were going to have a lot of issues with contact tracing and maintain an environment that was contained around percentage positive of cases that is really quite remarkable, even in the environment we have across the state that is 3 times this rate. Next slide. Some of what we were able to do is actually share this information with, this is a publication in Inside Higher Ed by the chancellor and myself that shared how the targeted coronavirus testing strategy at Rutgers University is helping suppress outbreaks and keep the community safe. Next slide, please. Rutgers Health has also been an innovation. There's an opportunity. Let's see if this video will work. If we could click on it, please. Due to the current prevalence of disease within New Jersey, Rutgers will perform weekly testing across all these at-risk groups. So we've actually invented COVID cola machines that you can swipe with your RUID, grab a COVID case, go home, use the saliva kit that was developed by Andy Brooks, who is a dear friend of ours and always will be. Grab and go vending and additional testing throughout. This can now be, and we have these vending machines along with other approaches throughout all the campuses. Next slide, please. This innovation is fired through Rutgers Health, but it's also supported through an enormous amount of volunteerism that's quite interprofessional and actually stretches between local and global health opportunities, where we actually learn from each other in a bi-directional approach that we've deployed, and actually maintaining these volunteers in collaboratories that have built tens of thousands of saliva kits for us so that we can continue to do this and keep our community safe. Next slide, please. Ultimately, the campaign on communication has been crafted depending on the age of the population. If it's students, we tend to use much more social media. We've been much more successful with those campaigns when they're targeted at specific age groups. And you'll hear more about how the chancellor and Mary have been working through podcasts and town halls to continue to inform and educate. Next slide, please. Some of the most important work we've done is actually created FAQs from testing to vaccine to inform the community. Next slide. And ultimately, we support resource centers for all healthcare providers as well. So the ongoing guidance internally across all of Rutgers University with the health system partners so that everyone's aligned as much as possible across the policies and guidances that we put out. Monitoring and exposure to pandemic or COVID-19 is controlled. Masking and PPE testing, wellness is something that we created actually before the pandemic and served us incredibly well during this process. And of course, everything we do has to have HIPAA guidelines. Please turn to academichealth.rutgers.edu. Next slide, please. We have manufactured our own PPE. Next slide. We have linked with our dental school and all our partners across several interprofessional approaches to really support all of our clinical partners and systems as we've just taken care of waves of patients. And the wellness program has been incredibly successful with the RBHF Chief Wellness Officer. I have one more slide or two more slides. The wellness programs have created dashboards that are available on throughout the entire intranet and internet that combines Rutgers University Hospital and RWJ Barnabas Health wellness opportunities and linkages between faculty, staff, trainees, and students, so that this is constantly available to them, some as much as 24 hours a day, 7 days a week. And the final slide, thank you so much for to all of our healthcare workers. As you can see, Rutgers Health, Clinical Affairs, Health Affairs, an enormous amount of work to innovate, to maintain databases, to create databases so that we can continue to see and prognosticate our clinical environment. Thank you very much. I'd like to introduce now Dr. Halkitis, the Dean and Professor of Biostatistics and Urban Global Public Health at the School of Public Health, and the Director, Center for Health, Identity, Behavior, and Prevention Studies, and a dear friend of ours, Terry.
Thank you, Vince, and thank you all for having us and being with us here tonight. Next slide, please. I think it's been an incredible year here at RBHS. An institution that's been on the move, on the rise, growing, moving rapidly, has been on steroids in some ways in the last year, doing even more than before. And I've been very happy to lead the School of Public Health in its effort to work with the state to really care for the well-being of the people and the populations of New Jersey. As a public health psychologist and an infectious disease epidemiologist, I always feel like I'm responsible to share my own belief that when we think about diseases like COVID, it's not enough just think about the virus. We have to think about the people and their behaviors. We have to think about the social conditions that perpetuate diseases in our country and in our world. And it should not be surprising to anyone that what we see around COVID-19 with regard to the disparities around race and around economic status is manifesting. We could have predicted this, but it points us again to the direction, which is the direction of the School of Public Health, which is one of social justice and of health equity. Next slide, please. We've thought about this idea at our school for a long time, this notion of targeting populations that are at risk, testing them, treating them, and tracing. And I'm going to talk a lot tonight about tracing and the contact tracing program we were able to develop and work with the New Jersey Department of Health on. Next slide, please. And so the World Health Organization issued this guidance on May 10th that indicated that contact tracing was an incredibly important strategy for all organizations, for all countries, for all states, and for all cities to undertake in the absence of really, really effective treatments and in the absence of a vaccine. And you will all remember we didn't have a vaccine, in the spring of last year. And so the way we could contain the disease was by identifying people who were exposed and seeing if they had exposed other people. Next slide, please. An idea that is not at all new and has been used for a very long time in public health with the Ebola crisis of 2014. And for those of us who were in the trenches like Dr. Strom and I around the HIV epidemic in the 1980s, something that was very common, how we were able to identify infections and clusters of infections. In fact, I will say that this moment, that this moment in our history is a really important one for public health, because I think the way we start to think about social justice and health equity after the AIDS epidemic or during the AIDS epidemic in the 80s and 90s, it provided a reboot to how we thought about public health. And I think that the COVID-19 pandemic provides another opportunity to move things forward in a much more grand way, putting public health front and center in the way it should be. Next slide, please. And so we were able to develop a contact tracing program that was focused on really engaging with people, that developed a centralized system that was embedded in effective, clear, and collaborative communication. And the New Jersey Department of Health trusted our school to be able to develop the contact tracing educational program for the contact tracers of the people of New Jersey. And I think this was a stroke of brilliance on the part of the New Jersey Department of Health, because they chose to partner with the accredited School of Public Health within the state of New Jersey, an institution that really is committed to the people of New Jersey, to the populations of New Jersey, and people who really understand what New Jersey is all about. I say this as a proud New Jerseyan right now, right here from my home in Newark. Next slide, please. And so we were able to use these following principles to develop our program, which included the seamless integration of our systems with healthcare, the inclusion of public health expertise, and real coordination with the whole local health departments. Because as we have seen with the vaccination program in West Virginia, when we use local authority, when we use institutions that people trust, we're able to vaccinate at really effective rates. And this is the same notion we brought to the contact tracing program we developed. Next slide, please. So who's a contact? Just so I remind ourselves always, these are individuals who you are in contact with for 15 minutes or more within 6 feet of each other. Contact tracing is as important as it ever was. And so keeping our physical distance, even in the presence of vaccine, is important because we don't know if people who are vaccinated cannot transmit the virus. Next slide, please. And so, as I said, we have to really bear in mind that even those of us who have 1 or 2 doses of vaccine, and soon we'll have a 1-dose vaccine, may still be able to transmit the virus to others. Studies are still being done. Stay tuned. That data will be available soon. Next slide, please. And so the principles for an effective contact tracing program are all of these: being open and transparent, being culturally relevant, maintaining, coordinating data management. And this is what we built into our program. Next slide, please. And so we wanted to build contact tracers who were drawn from our school, who knew public health, who spoke multiple languages, who were culturally and geographically aware, and who had great communication skills. Next slide, please. And we did this in coordination with the governor. And next slide, please. And we built a program that was based on 5 hours of basic contact tracing, 7 hours of in-depth case investigation and talking about COVID-19 in vulnerable communities, and really cultural humility and essential communication. And then, of course, we trained everybody on the platform for collecting the data. Next slide, please. Finally, developing these skills, we were able to not only connect people with testing, but also to connect them to social support services, because people have lives, and people are not just vessels in which the virus exists, but they have lives that they need to be supported in lots of different ways. Next slide, please. And so in a very, very intelligent way also, we built a mini contact tracing program in our own institution, recognizing that the Department of Health had so much work to do that we could also offer our services with them. And so over the course of the last several months, we've been working with the New Jersey Department of Health and the local health departments to actually help them with the contact tracing of our own populations here at Rutgers. Next slide, please. The data indicate that contact tracing still has a way to go. We have a lot of work to do, but our efforts continue to exist in that regard. And finally, last but not least, thank you for, next slide. Thank you for having me. This is where you can contact me. It's been an honor to work with the state, an honor to work with my peers here. And now I'm going to turn it over to my very dear colleague, my collaborator, Shobha Swaminathan, who is the Director of HIV Programs and Associate Professor of Medicine at the Rutgers, New Jersey Medical School. Shobha, it's all yours.
Thank you so much, Perry. Good evening, everyone, and thank you once again for joining us to give a brief glimpse into the various clinical trials that have been offered across Rutgers campus. Some of you may know that Rutgers is one of the few institutions that actually has an translational institute for medicine, and through the Alliance for Clinical and Translation Science has multiple research units across the various Rutgers campuses. In addition, I run one of the clinical trials unit at Rutgers, New Jersey Medical School, where previously we were funded to do mostly HIV treatment and prevention studies, and since last May have pivoted to conducting COVID treatment, prevention, and vaccine studies. Next, please. So the spectrum of studies that we have conducted, both at our side at New Jersey Medical School and really across all of RBHS have been multitude. We've been trying to study patterns of SARS-CoV-2 shedding in different persons, trying to correlate, the patterns of viral shedding with development of antibody responses. And most recently, some of my colleagues have also been working on following pediatric patients in long-term follow-up to see what happens to kids with COVID-19. As Perry mentioned, we're partnering with Perry on conducting a seroprevalence study in our area to estimate the amount of asymptomatic infection that we know exists a lot for SARS-CoV-2. Next. And I will mention a little bit about the Rutgers Corona cohort. It's unique in that I was both an investigator and a participant in it. And it really launched within 2 weeks of the start of the pandemic at the end of March 2020, which at this time seems like a lifetime away, was one of the few options for healthcare workers to really get tested for COVID-19. And I still remember self-isolating because of the numbers of healthcare workers who were getting COVID-19. And I used to have I had a separate entrance to a room with an attached bathroom, and really, not spending time or having dinner with my 7-year-old twins because I was afraid to pass it to them or to my elderly parents. And the only time I did that was the days I got tested on the study, because there was no other way for me to get tested. The study also showed that, as we now know, antibody levels do correlate with the severity of infection. So the study was very helpful for healthcare workers like me. And it was really support from the institution that helped us get the study off the ground in such a short amount of time. Next. There are also multiple other clinical studies that are targeting both hospitalized patients, so looking at various antiviral medications, remdesivir, as many of you may be familiar, but also looking at the role of a convalescent plasma and other antithrombotic agents to improve outcomes among patients with COVID-19. Additionally, there have been very few effective medications for use in the outpatient arena. So these various studies are really looking to see what can be done to prevent people from getting in the hospital. And the last study that we are conducting at NGMS is looking at the role of Regeneron monoclonal antibody, sort of as a post-exposure prophylaxis to prevent secondary transmission among households with COVID-19. Next. And then pivoting to really, I think, 2 key studies, and Rutgers is one of the few institutions that I think was able to offer 2 vaccine studies next across the institution. So at NGMS, we were one of the sites that enrolled for the Moderna mRNA 1273 vaccine study, and really ensured that the population enrolled was representative of the larger US population, particularly with a focus on senior citizens, persons over the age of 65, enrollment of minority communities, and those with underlying health conditions. Everyone knows the efficacy data, so I'm not going to talk more about it. Next, please. Also, at the Robert Wood Johnson site, we were able to offer the J&J or the Janssen vaccine, data for which were published just a week ago. In fact, Rutgers was the second highest enrolling site, enrolling almost 850 participants. And it really shows what can be done when we all work together successfully. And as we know, that vaccine was 85% effective in preventing severe disease. Next. So I really want to acknowledge everybody who's been part of this humongous effort. My research team is Research with a Heart. And next. With that, I'd like to introduce the next speaker, my boss and mentor, Dr. David Alland.
Thank you so much, Shobha, for that wonderful introduction. Good evening, everybody. If I could have the next slide, please. I'm going to discuss and just highlight some of the activities that we have going on now at the Center for COVID-19 Response and Pandemic Preparedness. The center is located in the International Center for Public Health in Newark, New Jersey, not far from the main medical campus. Next slide, please. And the reason why we decided to start forming the center is because we've been very fortunate that this building and the Center for Public Health that I run has one of the largest biosafety level 3 facilities in academia in the United States. So here you see 3 very happy people. They're probably happy because they're finally getting out of the BSL-3, take off their spacesuits. But we have these great facilities that let us work with high threat pathogens. And just as importantly, we have the human capital, over 50 investigators who are trained to work in these facilities. Training and certification in BSL facilities can take quite a long time. And if we were starting from scratch, the pandemic would probably be over before we started. But we had people who have worked with tuberculosis and bioterrorism agents and could work with COVID. And we did that. And the next slide, please. And already by March, we were growing SARS-CoV-2, the causative agent of COVID-19. You can see those little spots there on those blue plates are actually little plaques of virus growing. We could quantitate it, which we could do with TCID50 methods you see on the right, and RT-PCR and other methods. And having the capacity to grow the virus and quantitate it let us branch out into a whole variety of activities. We validated the first point of care test for SARS-CoV-2, a test that gave an answer within 45 minutes and was instrumental in our own hospital for triaging people into getting therapy, being able to go home, being isolated, et cetera. We were able to set up drug screens and worked with a number of groups, both academic and industrial, to screen new drugs against SARS-CoV-2, and had developed a large program to look at novel ways to sterilize surfaces, the air, and even body cavities, all dependent on our ability to culture virus. Next slide, please. We also, at Rutgers, have a really wonderful transgenic mouse facility. And with support from some other groups on campus, we're able to develop a number of transgenic mice that could be infected with SARS-CoV-2. And that enabled us to develop mouse models of infection and start looking at a number of things, including treatment and immunopathology, to better understand this disease. And our BSLP facility, which can accommodate many different types of small animal models, is working rapidly now to look at these kinds of things as well as transmission models. Next slide, please. Wanting to sort of jumpstart and take advantage of all of the great talent at Rutgers, we were able to, with the help of numerous people, including several on this call, including the chancellor and Perry, funded a large pilot grant program. We were able to award 23 grants in biomedical sciences and 13 in the social sciences out of a total of about 120 applications. And already what we've seen, this is a slightly old slide, we have seen now already over 400 publications related to COVID-19 come out from Rutgers faculty, partly in response to the support that we've given here. And we think that this is going to lead to even larger things to come. Next slide. So I've touched just very, very briefly on some of the activities we have in our center. I would have to spend an hour to go over all of it. But I think what would be even more interesting would be to try to be future looking. And so I was going to give a talk here when I started preparing this a few weeks ago to talk about the next pandemic. But unfortunately, it looks like the current pandemic is going to continue for quite some time. And this is just an example of the new strains that are coming out. We are a very nimble center, very nimble university. We heard that these new strains were appearing for SARS-CoV-2. We've already worked to develop assays that can detect these mutations and hopefully help public health officials figure out how fast these new strains are spreading in New Jersey and elsewhere, and shift the mutants to full sequencing to be able to get a better idea of what's going on in our state and our country. And I think it's our ability, which you've heard from all of our speakers, to be able to pivot very, very rapidly to COVID, and within COVID, pivot to where the real needs are, that we're able to do to address really at a moment's notice the new issues that come up. And that's what we're going to continue to do as time goes on. And I want to thank you very much. That's the end of my slides.
Thank you, Ashley, and thank you to all the speakers. I think you can see, this year in many ways has been terrible for certainly for us, for the state, for the world. But you can see why, as chancellor, I have felt extremely privileged to be able to lead this group like this, and to be able to see our roughly 10,000 people across RBHS come together in a magnificent way and really rise to the challenge, ranging from the nimbleness, as David was talking about, to the enormous clinical demands that Vince was talking about, to the huge efforts from testing to tracing and otherwise to address this pandemic. Something which, again, the world has been dealing with, will need to continue dealing with, and something we're going to need to learn to coexist with, though at least the beginning of the end is imminent now as we begin the vaccination campaigns. which is wonderful to see, and enormously rapid production of extremely effective vaccines, which is really unheard of. Let me move to the questions, and I'll remind everybody there's a question and answer box in your lower right-hand side if you want to insert questions. In addition, we got a bunch of questions in advance. We won't get to answer them all, but we'll certainly get to answer a number of them. Let me work backwards. So the last question that came in the question and answer box is how much of this, and this is directed to David, how much of this work is funded by the federal government?
That's a complicated question to answer. I mean, the shorter answer is that everything that we do is funded by the federal government. Our researchers fund themselves largely. Of course, when COVID started, we had to, within days, change our research, and the NIH doesn't work as fast as that. So we're federally supported, but took on new projects in addition to continuing to conduct the projects that we were funded for. And since that time, people have been writing grants and new funding has been coming in. And I would expect a big bolus of that to happen over the next couple of months as well. And
David, what do you see as the role of philanthropy in assisting that then?
I think the role of philanthropy is absolutely critical. We just for example, we put in a grant at the very beginning of the COVID epidemic to understand the natural history of COVID, to understand in families who've been exposed to COVID, what happens in the first day, the second day, the fourth day, the 10th day, in terms of antibody responses, cellular responses, RT-PCR. No one has still been able to answer that question. Our application to the NIH to study that got reviewed 2 weeks ago, and hopefully will be funded a month or two from now. It's way too slow. When you depend only on big government organizations, you can't get done what needs to be done. And as you saw, we're relying on volunteers to get the work done, because we haven't gotten the funding, and we'll get the funding for the questions for today a year from now, and that's not really sufficient if we just go for the federal funding.
Yeah, and obviously, as you know, the philanthropy donations obviously funded a lot of pilot work, yes. And a lot of the work that led to a lot of the federal funding. There's an enormous multiplier effect there in terms of philanthropy allowing you to respond very quickly, and that very fast response enabling you to be able to bring in much more money ultimately from the federal government. Another question that came in the box, and this one's directed to Shobha. How does one enroll in the study for people with pre-existing conditions that you talked about?
So that study, the Moderna vaccine study, actually was fully enrolled. So the study is no longer taking any new participants at this time. But you could email us at researchwithaheart at NJMS.Rutgers.edu, because there may be other studies that you may be eligible for.
Great. Now I'm going to turn to Mary to ask her a hard question, and a diplomatically difficult question. Do you agree with the governor's restrictive policies? What about the average weekly cases for New Jersey over the past few weeks?
I think that the governor has worked very closely with the information that he has to make careful decisions. And I think one of the things that's important is that there is no consensus necessarily on the very best way to do this. We have, on the one hand, people who feel like everything should be shut down immediately. And on the other hand, people who see the costs of shutdown, which are dramatic in and of themselves. And so I think that the governor has done a good job trying to balance the best science that he has available with the reality of how people are going to behave, regardless of what rule he puts forth. Because very much public health is sometimes an art of what the possible is, the art of the possible based on the science, the tools, and how people will behave. And I think Perry spoke to that as well. And so I think he's done a good job balancing all of those pieces to try to keep us in a good and controlled place. I think New Jersey and New York were some of the states that were first hit and hit hard. And the rest of the country could have benefited from learning from how we reacted to that. And unfortunately, we haven't seen that. But New Jersey and New York have worked very, very hard and have been managing through this for a year now.
Next question is for Vince. Vince, you want to talk about the university's plans for vaccination, and when, how is that being organized, and any sense of when that'll emerge?
I think we're about 2 weeks away from soft launches in New Brunswick, Piscataway. We have 2 sites that we applied for. We're waiting for the state, and then we need vaccines. So there's still a couple of variables that we can't control. But if those continue to increase, as we hope and they will over the next several weeks, our intent is to be able to open a site within the School of Pharmacy and another one at 91 Bleecker Street in Newark. That, along with the Blackwood site in southern Jersey, we believe, working with all of our regional leads, that should cover at least the overall ability to vaccinate everyone that we have to from a Rutgers community, Brian. How we wind up creating a approach is still something that we're looking at. We've had some of the ethicists across Rutgers now involved in a conversation that started on Monday. And I'm hoping that over the next several weeks, we'll be able to develop a schema that people can review transparently like we did TPAC. So I think we're in pretty good shape right now in terms of being able to do all of this. We started from scratch again, including the registrations, and people should be hearing about a approach to be able to begin testing for interest again across the university shortly. And I'm hoping within 2 weeks, we'll be able to do this if we get the vaccine that we need and final state approval.
Yeah, and I think it's important to emphasize some comments both Vince made and Mary made beforehand. Rate limiting step right now is vaccine.
Yeah.
The state already has capacity to vaccinate 470,000 people a day. It is receiving only 100,000 shots a week. So we're a long, long way away from being able to vaccinate. And there's 4 million people in the state who've now been authorized so far to be able to be qualified to get the vaccine. So we're a long way from being able to get to everybody. Rate limiting step is the vaccine. The state has lots of vaccination sites, and as you probably heard today, people that talking about expanding it to all pharmacies in the state, and soon maybe physician offices and otherwise. There isn't a lack of sites anymore. It began that way. The real lack is vaccine, and toward that end, the news about the J&J vaccine is very encouraging, as clearly the existing vaccine manufacturers are gearing up as fast as they can, but having additional vaccine manufacturers clearly would be very useful. What are the numbers for one of the questions just asked, what are the numbers for the new mutations? And do you want to talk about the new mutations? Is it spreading more rapidly than the initial virus? What are the implications of the new mutations? I don't know if Mary, you want to give a shot to that one?
Sure.
I give you the hard one.
I'll give it a try. So we know at least 3 different variants or mutants that have been identified. I believe in New Jersey we have only so far identified the one from the UK. What we understand so far, and we are still learning about each one of these, is that they are more contagious. And so we would anticipate that these new variants would spread more quickly in the population and cause more cases. We haven't yet seen that they cause more severe illness, but just having more cases would cause more people to be infected, more people who are infected, more people potentially that could have severe illness. And then we might also see more hospitalizations and potentially deaths as a result. And that's what we know so far. I think that the 2 other variants have been detected in other parts of the country. And because of the dynamics of our state being so much of a hub for transportation, I would imagine that we will likely see them in our state at some point. The good news is that we do know how to prevent the spread of this disease through masking and distancing and being very careful. There's also some reason to feel optimistic about the vaccine being effective against them, maybe not as effective, but effective. And so if we all collectively focus on using the tools that we have and know work, we can control the spread of the new variants if we work together.
Right, can I add something to what Mary said, if that's all right, which is, I think
Please,
Mary alluded to this, and I think it's incredibly important. So we have the vaccine The vaccine is another tool in our arsenal. It doesn't mean we get rid of the old tools, which are the masking and the distancing. Those things have to continue to happen, you know, as rigorously as they have before. It's not time to let our guard down. And it's about how do we continue to engage people to make them feel safe, to go about their lives while also wearing a mask and stuff. So we have our work cut out for us, but there is a future here, and there is a future that is going to look much more hopeful than it does today, you know, in February of 2021.
And I think, yeah, go ahead, man.
I was just going to say, I do think, Perry, just to build a little bit on what Perry's saying, there's a lot of silver linings in the pandemic, and many of them also are dealing in a conversation we're having on behavior and how we behave in our own environments, you know, how that affects learners. Ultimately, the approaches of how we're going to really define team care, and what this pandemic has taught us, that we're all in it together, I think in many ways is going to define a lot of what we do with Rutgers moving forward as an approach to putting that the patients as we have. The pandemic's really accelerated that conversation across the university, and I think we all find that to be very exciting.
I will add to one more. I'm going to like a little tennis here with men's, which is like I think Shobha and I have also seen in our work with HIV that this is just fast forwarded telemedicine. It's like we've had no choice but to like make it work because we have a population that needs to be continually engaged in care. And so it sort of has forced our arm. And I with you, Vince, there always has to be a silver lining in all of this horrible situation.
So let me ask three related questions that have come up. One, and I'll ask all three. One is, how is vaccine hesitancy among healthcare providers being addressed? How does vaccine hesitancy among healthcare providers impact the strength of their vaccine recommendations to others? Second is, how do you get anti-vaxxers to convert their beliefs, including healthcare individuals? And third is, what is the refusal of a certain percentage of the population to accept the risks of COVID and public health advice? Tell us about the need for improved science communication.
Wow, that's a lot of question.
Write that question, Brian.
Yeah, that's an essay. It's an essay question. So look, I mean, let's acknowledge the fact that people who are hesitant to the vaccine, this idea that people have vaccine hesitation is not a new one. We have a history of this in our society, right? We know that this exists. Whether or not, you know, it's appropriate is a subject for debate. So what we're doing, I can tell you here in Newark, is we are convening. So we've developed this urban public health paradigm that marries the efforts of, you know, the healthcare system and public health and industry and the community. And we bring people to the table and we think about what is it that we need to message correctly? And, you know, and how do we deliver that message? And how do we deliver that message in a culturally appropriate way? Because how you tell a 78-year-old who's living in Newark that the vaccine is helpful is going to be very different than how you tell a 22-year-old who's living in Omaha, Nebraska, right? And so thinking about these tailored messages and having the community tell us what they need to hear. The second thing I would say, and then I'll toss it to one of my colleagues here, is the people who have to be delivering the message have to be trusted. Right. And so if you have key informants in our society, like these pharmacy workers in West Virginia, and people trust them, then the vaccine hesitancy will decrease. And the politics of the last few months have actually just changed the direction of vaccine hesitancy too.
Any other comments from Mary? Did you want to?
I was going to say, Brian, part of your question is around healthcare workers too, I think. And I think early on, there was a lot of concern from the healthcare community about the vaccine. And some of that has been significantly reduced by seeing the data. I think that the amount of transparency on the data related to the vaccines has been tremendous. And many healthcare workers that originally were talking about being concerned and were not willing to get vaccinated have since gotten vaccinated. I think also, just because things have gone so well, and we have so many people who have not only gotten vaccinated, but are raving about the vaccination. And I have to tell you, I have healthcare workers in my family, and I've seen all the pictures of them getting vaccinated. And I started to cry when I saw it because I felt such relief that finally I could be a little less worried about them. Now, I'm not yet eligible, but I've registered like at 10 different places. And I think that it's really changed the dynamic when you see people getting vaccinated, feeling that sense of relief, and also doing quite well afterwards, maybe complaining about a sore arm. There have been a few issues with having an allergic reaction, but relative to many other things, it's so minimal and easily managed that I think people are feeling really confident in the vaccine. And the more healthcare workers feel confident, the more the public will also feel confident. I think that was part of the question as well, because they look to their providers for guidance on all of their healthcare issues, including this. And so I think we're moving in the right direction, and it's not wrong to be hesitant in the beginning of a new medicine and vaccine. And this is your area of expertise, Brian. But, I think the more evidence that you see, the more confidence everyone will have.
This is my area of expertise, and it's probably useful to emphasize. I spent 40 years studying side effects of medications and vaccines. I've been vaccinated. I just got the second dose of the vaccine on Saturday. Is there a risk? Of course there's a risk, but the risk is so much dramatically lower than the risk of the disease. And that's the issue. Life is not without risk. We walk across the street with taking risks. These are incredibly effective vaccines and remarkably safe. It's just unfortunate they became politicized in the process. So another pair of questions, and this is for Vince, related to the vaccine campaign the university vaccine campaign. How can alumni get involved in local efforts for vaccine delivery and other initiatives for the community? And are you looking for volunteers to help with the vaccination effort? If so, how do we go about signing up?
So there is information on the websites to be able to volunteer. We are developing also vaccination corps that can do that. So we will be also sending out other information over the next week or so, but there is on the websites that I've had in the presentation an opportunity to also volunteer. So that there should be links there for people to be able to get organized and contact us. There's still need, I believe, with the vaccination corps that we've been building, and I think last time that was updated, people being directed there across the campuses as well.
Yeah, and the other need, obviously, always is with philanthropy, is in terms of assistance with resources. You've heard Vince talk about all the volunteers, but the volunteers don't get paid. But you saw his machines giving testing. You saw these efforts are not free to be able to run going forward, and it's not the kind of thing, unlike research grants that you can apply for NIH grants for. Again, research grants, you still need philanthropy in order to do the pilot funding, but beforehand, as we talked about. So we've got time for one. Let me ask one more complex question and ask each of you to respond in turn. And the question, and it was the question that came in before it, is what is Rutgers doing that's different from other institutions? What makes them integral and so irreplaceable in this fight against COVID-19? So looking around my screen, so Shobha, you want to start?
Sure. Thank you for that question, Brian. I think the one silver lining with this pandemic, if anything, has been the ability to reach and connect with people across RBHS. Even though I had we ran a clinical trials unit at New Jersey Medical School, I think with COVID-19, I've had the opportunity to collaborate with other investigators at the CTSA, with Ray, Jeff Carson, other people at RWJ, and I've always worked with Perry, but more so closely, and really trying to leverage this translational work. Now I'm working with some basic scientists at the Public Health Research Institute, and trying to make that bridge from basic science to clinical trials to implementation in the community. And having all of those pieces under one umbrella is really, I think, very fulfilling.
David?
Yeah, if I could just add, so, a 10-second story. I was at the World Health Organization in November talking about how, as a diagnostic people, we could respond to the next pandemic. The conversation to get that actually done on a worldwide basis was, if you imagine that as being a mile, we got like an inch over 2 days of intense discussion. Fast forward to being at Rutgers, which is an incredibly collaborative place where people don't compete. They find ways to work together. It's absolutely amazing. When we had to get all the permissions to do a clinical study in diagnostics at Rutgers. We got everything done because of the support here in 3 days, what usually takes 6 months. And that's because people work together. I could call up Brian if I needed help. We've been able to, as you've heard just from today, move forward so fast because people work together, people understand how to break down barriers. There's a lot of smart people in the world, but there's not a lot of smart organizations. And Rutgers is a smart organization. And we can really build on that and make a big difference in a fast moving epidemic.
Right, thank you. Perry?
Brian, just to add to that, I think,
go ahead, Mary.
I think that we have a statewide presence, which makes a big difference. We also have an extraordinarily diverse community. And so when you look at doing science that has implications across the country and the world, having a diverse community to work with in collaboration is so important. You saw the results in terms of the clinical trials and the vaccine trials. Think about how important that was on the national level in terms of talking about, was this vaccine effective in different subpopulations of our communities? And as we talk about all of the social dynamics, the issues of racism, the issues of all of the social and emotional health and the cultural context that all of that takes place, we can do that kind of research in New Jersey, and many other states can't do that. And we're doing it in collaboration with our state health department, which even makes it that much more relevant and actionable immediately. And I think that, I remember this when I sat in the seat at the health department, and it is so critical and so much more obvious to me now being at Rutgers. It's really a unique position that we are in.
I'm going to say, I actually think other states could do it, that they don't do it. And we do it. And that's what's different. And I think what is amazing about this institution is and the work we've done over the last year is it's with and for the people of New Jersey. And it's critical to say with and for, giving voice to those who need to have voice and doing work for them. And it's like really an amazing institution where Shobha can push me from her clinical perspective. I can push her from my epidemiological activist perspective. And we end up in this really amazing space doing this really, really fundamentally good, holistic work. And that's what is really, really energizing to me every single day.
Ben?
Brian, I think many of my colleagues have said it in some way or other, but I really believe that Rutgers and our definition of Rutgers Health as the clinical side of the university, in many ways, it's been able to tap this idea of a real nurturing community and one that supports each other, and it's incredibly respectful of each other. And I think that the umbrella that's been used before, Rutgers also has the unique opportunity to have so many interprofessional schools that span the breadth of our understanding of what is essential for population health, which is much more effort laden than just intervening when someone fails or someone needs to be or has an acute issue. Maintaining someone's health requires a collaborative approach, and it requires that we consistently put that patient in front of us and say, what's the best way we can do that? Because that means we all have to check our egos at the door. And there's such a wealth of subject matter expertise at Rutgers that it's actually humbling when you actually listen to each other. And I think that's what we've all started to really uncover, and that the pandemic has accelerated. But that also requires an enormous amount of support and philanthropy as we begin to support all these systems that we've uncovered are necessary to really communicate, to create team research, team science, team education. Rutgers can do that. The umbrella is complete. It's very full, but it needs to be connected, and it requires investment to do that.
Thank you all. One of the questions that came up, by the way, is the website for if people wanted to volunteer. I don't know if Vince, if you know that offhand. Otherwise, people can just send it to my chancellor box, and I can forward it accordingly. But
and I don't have it on the tip of my head, and I would prefer not to do that on air. So we'll look for it in supply.
Yeah. So again, people can send it to my chancellor email box, and I can forward it accordingly. So thank you all. I hope this has given you a little bit of a picture of the enormous impact that Rutgers in general, RBHS in particular, has been having in this pandemic, again, ranging from clinical care, our 1,000 docs providing enormous care, saving people's lives through this pandemic, and manufacturing PPEs and manufacturing ventilators and everything else that had to be done last spring, to the diagnostic testing to develop, to the public health interventions, to the contact tracing, to just enormous contributions from one end to the other, now in terms of vaccination and mobilizing studying the vaccines and now mobilizing vaccination campaigns. I'm extraordinarily proud of what we've done over the last year, and look forward to seeing what happens going forward. And I'm grateful to the people listening for the contributions everybody has been making and is willing to make, and will hopefully make in the future, contributing to it all. So thank you, everybody, and have a good night.